Robotic kidney cancer. The tumor arises from the kidney, and if it is a malignant, it's called kidney cancer. Generally, this type of tumor is arise from the tubules of the kidney. However, there are many type of cancer arise into the kidney, but more than 85 to 90% of the kidney cancer is clear cell type of the kidney cancer. How patient present with us in case of the kidney cancer? Nowadays, so many patient is doing body checkup and routine checkup, ultrasound for the other purpose like abdominal pain. So more than 60% of the patient is diagnosed incidentally. That means patient does not have any symptoms related with the kidney, and they do investigation for the other purpose and diagnose with the tumor in kidney. However, those patients who diagnose with symptomatic kidney cancer is usually later stage like stage 3 or 4, and prognosis in that group of the patient is very grave because the patient having either hematuria or any lump in abdomen or any pain is usually presented with the metastasis in other part of the body, and the prognosis is not very good in that group of the patient. So in case of the incidental diagnosis, what is the further investigation we will do? We will do either ultrasound. After ultrasound, we will do renal protocol CT scan. Renal protocol CT scan is we will give some drug into the vein and take a specific sequence of the CT scan, which will exactly characterize the tumor. Where is tumor situated? What is the size of the tumor? Whether this tumor is involved into the renal vessels or not, what is the relation of this tumor to the other structure of the body. After that, in more than 70 or 80% of the cases, there is no need for any biopsy of this tumor. Generally, we will do biopsy in all other cancer apart from the kidney. If the patient is younger and less age, we directly do the surgery if it is a smaller tumor. Staging of this tumor is depend on the size of the tumor. Like if the tumor is less than 7 centimeter, it is called stage 1. Again, stage 1 is divided into stage 1A and stage 1B. If it is less than or equal to 4 centimeter, it is called stage 1A tumor. If it is in between 4 to 7 centimeter, it is called stage 1B tumor. Up to the 10 centimeter, it is called stage 2 tumor, and if this tumor is involving into the fat or into the central part of the kidney or into the vein, it is called stage 3. So incidental diagnosed tumor is usually into the stage 1. So in stage 1, the best treatment for this group of the patient is to remove the tumor and save the kidney, which is best achieved by the nowadays by the robotic system. I think in every city in major hospital, this system is now available in most of the city in India also. And in worldwide, if we see into the European country or into the Western country, more than 85 to 90% of this type of tumor is operated by preserving the kidney. That means there is no loss of kidney, very minimum loss of the nephron. So it will give a long-term benefit like survival benefit as well as renal function benefit on long term. So this is the available best technology in world where we will put only 4 to 6 small less than 1 centimeter incision and put a port and put an instrument inside the body. We isolate the kidney, we control its blood supply by applying clamp, and then we will remove the tumor within the 30 minutes of time and we will suture the kidney again. That kidney function normally as it worked previously, and also the patient will get tumor free with very low recurrence local rate, like a local recurrence rate is less than 5%, and probably as compared to other cancer, it's the best treatment, and there is a very low recurrence rate as well as very low metastatic rate. Today on the kidney cancer day, early diagnosis is the most important key point in kidney cancer. We can not only treat the cancer but also preserve the kidney function with best available technology like a robotic system. As well as In this type of kidney cancer, 9 to 12% of the patient have a hereditary risk of the kidney. Hereditary means those patients who have a family history of kidney cancer might have cancer. And usually this type of cancer happens in lower age group, like less than 40 years of age. Those patients require genetic counseling and genetic testing also.